Hemodialysis apparatus dialyzer dialysate blood delivery system dialyzer, artificial kidney, dialyzer. Several types of dinosaurs are available including flat plate and whole of fiber mold devices. There are differences in solute clearance rates, example urea creatinine large molecules, as well as ultrafiltration rates. Many centers that perform long-term dialysis disinfect and reuse the dialyzer for the same client to reduce costs. The dialysate solution is altered to fit the client's need. Hemodialysis schedule. Hemodialysis for end-stage renal disease must be continued intermittently for the client's lifetime unless successful kidney transplantation is performed, or typical schedule is 3 to 4 hours of treatments 3 days per week. The schedule varies with the size of the client and the type of dialyzer used, the rate of blood flow and other 4 factors. Plastic chamber contains bundles of capillary tube through which blood circulates while dialysis solution travels outside the bundle in opposite counter current direction. Diffusion and ultrafiltration happen here. Membranes using in dialyser: cellulose substituted cellulose, cellulose acetate, cellulose synthetic cellulose/hemofan synthetics, polyacrylonitrile, polysulfide, polymethyl methacrylate. Dialysate solution used in dialysis which has same solute concentration as those in plasma. Water used in dialysate is purified by reverse osmosis. Contents of dialysate: sodium 136-140 mol/L, potassium 0-4 mol/L, Mg2 plus 0.25-0.75 mol/L, HCO3-27-40 mol/L, buffer. Dextrose 0.55 mol/L. Blood delivery system: blood pump moves blood from access site to the dialysis and back to the patient. Blood flow rate 250-500 ml/min. Access for hemodialysis/vascular access 1. Arteriovenous fistula/AV fistula, AVF, 2. Arteriovenous graft/AV grafts, average, 3. AV shunts 4. Percutaneous access 5. Cuff tunneled dialysis catheter 6. Temporary access sites: A. Internal jugular vein, B. Femoral vein, C. Subclavian vein. Arterial venous fistula. Fistula is created through a surgical procedure in which an artery in the arm is an outermost to a vein in an end-to-end, side-to-side, side-to-end or end-to-end fashion. The result is an opening of fistula between a large artery and large vein. The flow of arterial blood into the venous system causes the veins to become engorged. These fistulae require up to 6 weeks to mature before they can be used, which makes this approach inappropriate for immediate hemodialysis. Peritoneal dialysis or large venous access catheters may be used while the fistula is maturing. External arteriovenous shunts are rarely used. The internal arteriovenous graft is used for chronic dialysis when the arteriovenous fistula is not possible. In this approach, an artificial graft made of various synthetic and biological materials is used to create an artificial vein for blood flow. One end of the artificial graft is anastomosed to an artery, tunneled under the skin, and anastomosed to a vein. The graft can be used 2 weeks after insertion. Complications include clothing, aneurysm, and infection. Once the fistula or graft is placed and ready for use, 2 15 to 16 gauge needles are placed in the access at each dialysis treatment. A pump pulls arterial blood out by way of the fistula and into the hemodialyzer. Blood returns to the client by a tube connected to the other needle. Alternatively, single needle dialysis may be used. With this device, 1 pancha is required is time, but da may be signified recirculation of dialyzed blood, meaning that clearance rates are decreased. Internal arteriovenous graft may cause hand swelling or ischemia, carpal tunnel syndrome, hemorrhage, thrombosis, and aneurysm. Besides the arm, the subclavian, thigh, and ankle areas may be used as sides for hemodialysis access. Subcutaneous anastomosis of an artery of the adjacent native vein takes 6 weeks for development. Arterialization of vein: both the dialysis needles are inserted into the native vein. It is anastomosis of an artery to a vein sites: radial artery, encephalic vein, brachial artery, encephalic vein, brachial artery, and basilic vein. The increased blood flow and pressure causes the vein to dilate. Types: radiocephalic, first choice; brachiocephalic, second choice; brachioradialis, third choice. Pre-operative care in AV fistula: explain full procedure and aftercare. Let the patient talk to someone who has a well-established fistula. Fashion should be well hydrated before the surgery part preparation.